Theatres are the most expensive resource we have, and it's also where patients receive their treatment. So it's important to get the most out of our theatre space. Introducing Synopsis in pre-op has given us additional visibility and control over the beginning of the pathway, which means that we're able to get the most out of our theatre space. At Aintree, our main problems are around theatre utilisation. We weren't able to fill lists properly, particularly at short notice, and that was creating additional demand on pre-op, and it was proving very difficult for the pre-op services to actually handle that. When we looked into the reasons why we had these problems, one of the contributing factors was a lack of visibility on the patients who were actually ready to go. Because the information is now collected digitally, we have greater visibility on who's fit for surgery. This allows us to improve the surgical pathway after pre-op.
Once patient comes in, they register in the reception, and then we have a triage nurse who log the patients in on the computer in the waiting room. So the patients will then have the opportunity to fill in all the questionnaire about past medical and surgical history, family history.
From a patient perspective, being able to engage and begin the pre-op questionnaire within the waiting area is better use of their time. But from our perspective, an organisation perspective, because we accept walk-ins into our pre-op environment, we've been able to introduce an element of control over the flow of patients, where before on a paper-based system, we simply didn't have control. And we were reliant on the patient sitting in waiting areas until the nurse became free.
It's also helped greatly to reduce the patient's time spent in pre-op, because patient comes in and they have the opportunity to fill in all their medical, surgical information before I even see them. So by the time they get to me, I've already know what I'm looking for and which way I'm heading.
It is less time consuming. Obviously the information's there, it's just most of the time it's a matter of clarification, and you can have that eye-to-eye contact more as well.
It has helped greatly to be able to interact with patients and not only focusing on the paperwork, but you have that face-to-face contact with patients, and also to help alleviate patients' anxiety when they come from clinic. Sometimes they've been given a bad diagnosis, they are so anxious, and you're able to listen to them and reassure them.
Synopsis is very easy to use while I'm doing the patient's observations. When I use Synopsis, the first thing I do is enter the patient's height and weight, followed by the blood pressure, the oxygen levels, and then the heart rate. Clinical nurses and healthcare assistants are able to use Synopsis at the same time.
It's so good that whatever outcome I have got on that patient, it will be available to the surgical team. The anesthetist will be able to access it, the theatre staff will be able to access it, and even the surgeon will be able to access the information, even on the day or before the day, to prepare for that patient.
Any system that we introduce has to be able to pay for itself. We're under quite tight financial controls, so any spend needs to be able to justify itself pretty rapidly. We're able to demonstrate a return on investment achieved within just 10 days. The total in-year savings have been identified as 2.7 million, with phase 2 as a conservative estimate anticipated to deliver a further £4 million. We sincerely hope to continue our very close working relationship and partnership to get the most out of the products we have for our staff, but also for our patients. The next phase of which really for us is to look at using Synopsis Home to introduce further control into our pre-op process from our perspective, but to hand some control back to our patients so that they can begin their pre-op journey from the comfort of their own home.